Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
This deep dive was created using generative AI tools to support accessibility and clarity. The content is grounded in the research and instructional work of Dr. Michael Jones. Welcome to the deep dive. Today we're diving into something really important and honestly fast-moving in mental health: telehealth crisis intervention.
Yeah, it's a huge topic.
It really is, and it's more than just, adding some tech. It feels like it's fundamentally changing how we support people when they're really struggling.
Absolutely.
So our goal today is to kind of unpack all of that, where it came from, what's working, the tricky parts, and maybe where it's all heading.
And it really is a paradigm shift. I think that's the right word. It's not just the emergency fix we saw pop up during the pandemic,
Right.
It's become this incredibly accessible, immediate, and scalable way to offer support.
Scalable, that's key.
It provides vital infrastructure. Think about people who, maybe because of stigma or distance or other barriers, just wouldn't walk into a clinic.
Makes sense.
This opens doors. And it ties right back to our core ethics, that primary responsibility to client welfare. ACA's A1A, basically.
Okay, so let's pin this down. When we say telehealth crisis intervention, what exactly are we defining there? What's in that basket?
Good question. So simply put, it's delivering mental health crisis services using electronic means.
Okay.
And that covers quite a bit: assessment, evaluation, treatment, even remote monitoring when someone's in acute psychological distress.
Right.
For us as professionals, it means we need to get comfortable with technology's role, but without losing sight of our ethical duties. That link to the ACA code, A12, and the KCREP standard, specifically 2.F.5K, about technology and counseling. That's central.
Got it. And obviously none of this happens in a vacuum. You need the right tech setup. What's that foundational piece look like? We hear terms like technology-assisted crisis intervention and digital infrastructure.
Exactly. Technology-assisted crisis intervention is just using those digital tool platforms, apps, communication tech for that immediate accessible support, sometimes anonymous even.
Okay.
And early work showed huge potential there. But for it to actually work and work ethically, you need that solid digital infrastructure. Meaning reliable internet, first off, then secure platforms. This is crucial. Got to protect client data. Think ACA A.12.G, ensuring technology benefits clients.
Yeah.
And user-friendly interfaces. If it's clunky, people won't use it, especially in a crisis.
Right. You can't be fighting the tech when you need help.
Precisely.
Okay, this is where, for me, it gets really interesting. What are some models or frameworks that actually show this works, like proven effectiveness?
Yeah, great question. One really strong example is the Crisis Care Program.
Okay.
It's evidence-based, and it uses a digitally adapted version of CAM. That's the Collaborative Assessment and Management of Suicidality Framework.
Ah, CAMS, yeah.
Studies show it's feasible, it works even in outpatient settings, and importantly, it leads to significant drops in depression, anxiety, and suicidal thinking.
Wow, significant drops.
Yeah, it really demonstrates that a structured, proven approach like CAMS, even adapted for telehealth, can be incredibly effective. It hits those MBCC Domain 5 competencies around intervention.
That is powerful. What about maybe broader applications? Thinking about kids and teens, school-based telehealth seems like such a logical fit there, especially with all the hurdles young people face getting help.
Oh, absolutely vital. School-based programs directly hit those systemic barriers you mentioned: cost, not enough local providers, transportation issues.
Things that stop kids getting help fast.
Exactly. And these programs really highlight the need to understand diverse populations. That's KCREP 2.F.1 meter on diversity and advocacy, and to push for better access. But critically, you have to factor in development, right? Involve families appropriately, which can be tricky, and maintain strict confidentiality. That's ACA B.1.C territory, always. MBCC Domain 2 as well, on human growth and development.
It sounds amazing, but also complicated. Especially, how does this work if someone needs help, but they're, say, in a different state or even a different country? Crossing those lines seems tough.
It is tough. That's the whole cross-jurisdictional crisis response challenge.
Yeah.
And yeah, it's complex.
I bet.
The pandemic really forced the issue, didn't it? Suddenly there was this urgent need to figure out licensing, streamline things so qualified folks could help people across state lines.
Yeah, it accelerated everything.
It did. And ethically, for practitioners, you have to know the legal rules where your client is. That's ACA C.2.A, professional competence. And you've got to be prepared. Avoid causing harm because you aren't ready, ACA 8.4b.
Super complex. Are there examples where this has worked internationally, like models for that kind of cross-border response?
Yes, definitely. A really notable one is the TeleHelp Ukraine initiative.
Ah, okay.
It really shows how you can leverage global networks for mental health support right across borders, especially in conflict zones. But doing that work effectively means deep cultural competence.
Right.
You have to understand language nuances, adapt trauma-informed care for virtual delivery. It connects to KCREP 2.F.2.A on social and cultural diversity, and NBCC Domain 3 competencies.
Okay, so we've got the big picture, the ethics. Let's talk tools. What specific technologies are making this happen day to day?
Well, the basics are things like secure video conferencing. That's huge. And shared documentation systems that allow teams to coordinate.
Right, the collaboration piece.
Yeah, vital for multidisciplinary responses in real time. And the key word there is secure. It has to be HIPAA compliant, HIPAA, protect that sensitive data. ACA B.3.C on confidentiality and technology is paramount.
And looking maybe a bit further out, I keep hearing about machine learning, predictive analytics, these more high-tech tools finding their way in.
Yeah, that's definitely emerging. And it does raise an important question.
Yes.
Well, the idea is using algorithms to analyze digital patterns communication.
Yeah.
Maybe to potentially identify someone heading into crisis before it fully escalates.
Proactive outreach, kind of?
Potentially, yes. Personalized interventions based on those patterns. But the ethical questions are significant.
Like privacy.
Privacy, absolutely.
Yeah.
Informed consent, ACA A.2.C. How do you get that for this kind of analysis?
Yeah.
And just that fundamental balance, how do you use this powerful tech without losing the human connection that's so vital in therapy, especially crisis work?
Lot to think about there. So pulling back a bit, what's the bottom line on effectiveness? Does the evidence really show telehealth works for crisis intervention?
Yes, the evidence is strong. We have randomized controlled trials now, particularly around suicide prevention efficacy.
Okay.
They show significant reductions in suicidal ideation, better engagement with treatment, using things like clinician-guided crisis response plans, or even self-guided safety planning tools delivered via telehealth.
And are people sticking with it?
That's another key, finding high retention rates, good patient acceptance. It suggests that for some, virtual delivery might actually improve engagement, maybe by removing some of those barriers we talked about. It supports KCREP 2.5J, understanding research and evaluation.
That makes sense. What about after the immediate crisis, that post-crisis follow-up piece? Is telehealth useful there too? It seems crucial for preventing relapse.
Absolutely crucial. And yes, telehealth shines there too.
Yeah.
Research like Basu's work points this out. And it links to NBCC Domain 5 on helping relationships.
Wow, so?
We see better appointment attendance, fewer no-shows for telehealth follow-up compared to in-person.
Really? That's interesting.
Yeah, studies like Kennenberg and Statters, Xiao et al., they show it clearly. It just makes it easier for people to keep up with care by tackling those practical hurdles, transport, childcare, even just the stigma of walking into a clinic. It keeps that care continuum accessible.
Okay, this is painting a pretty positive picture overall, but surely there are still challenges, hurdles the field needs to overcome. And where does it go next?
Oh, absolutely. Challenges remain.
Yes.
A huge one is the digital divide.
Access, yeah.
Exactly. Gaps in reliable internet. Access to devices. This hits vulnerable populations hardest. And that raises serious ethical questions about equity, fairness. It pushes us towards advocacy, like ACA 8.66a suggests.
And what about the professionals? Is everyone trained and ready for this shift? Provider training and competence?
That's another big area.
Yeah.
The rapid shift definitely showed gaps. Doing this well isn't just about knowing how to use Zoom, right?
Right.
It requires specific skills, building rapport remotely, doing accurate risk assessment through a screen, confidence with the tech itself. It ties back to ACA C.2.A on competence and KCREP's 2.F.1K requirement for technology literacy. And we can't emphasize privacy and security concerns enough. It comes up again and again.
Understandable.
Because the sensitivity, you need meticulous attention to confidentiality, data security, HIPAA compliance.
Yeah.
Building and maintaining user trust is absolutely fundamental. ACA B.3.C again.
We also touched on cultural adaptation earlier, ensuring this works for everyone, diverse populations, maybe refugees, kids, that cultural responsiveness.
Critically important. Telehealth has shown real promise for for example, with refugee populations, like work done with Syrians in Jordan. But it demands understanding different ways distress is expressed, cultural contexts, communication styles, especially with the trauma survivors. That's CACRB 2.F.2.B on diverse populations and NBCC Domain 1. And for kids and teens, adapting means considering development, family involvement, age-appropriate tech, and those unique consent issues for minors.
So lots of nuances. Looking ahead then, what's exciting? What future directions and innovations are on the horizon?
There's some really interesting stuff emerging. Virtual reality integration is one.
VR.
For things like exposure therapy, skills training, creating controlled, immersive environments for therapy. Still early days, but potential there.
Wow, okay.
And also these collaborative hub models for crisis intervention. The idea is using tech for rapid response and coordinating resources really efficiently, especially helping rural or underserved areas. Think system-level coordination, which touches on NBCC Domain 5 again.
Okay, so as we start to wrap up this deep dive, it feels clear that telehealth crisis intervention isn't just a temporary fix or, a pandemic workaround. It's a real evolution.
It truly is a fundamental shift.
With huge potential, it seems, to improve access, make interventions more effective, and ultimately improve outcomes for a lot of people.
Definitely. But, and this is the important but, making it really work well, demands constant attention. We have to stay focused on the ethics, on cultural responsiveness, making sure providers are competent and confident,
Right.
and actively tackling those systemic barriers, like the digital divide. It's this ongoing balance, isn't it? Embracing innovation while grounding everything in solid therapeutic principles, always prioritizing client welfare and safety.
A perfect summary. Okay, as you, our listener, reflect on today's deep dive, here are a couple of questions to consider. First, how might the principles and models of telehealth crisis intervention show up in your current work or role? Even if you aren't directly providing crisis services yourself, where might you see overlaps or applications? And second, thinking about the ethical considerations and practical challenges we discussed, what steps might you want to take personally, maybe to enhance your own competence in this area, or perhaps to advocate for better access within your professional context?